Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Preparing for surgery. Introduction. Surgical procedures can treat or prevent pain, diagnose a health problem, or even save your life. This program will help you prepare for surgery. By understanding the different steps to prepare, you can help ensure a successful operation and a fast recovery. Planned surgery involves 4 basic steps: surgical consultation, pre-surgical visit, day of surgery, patient discharge. During the surgical consultation, you will meet with your surgeon to discuss your surgical treatment options and the benefits and risks of surgery. This program is for patients who have already been scheduled for surgery. The purpose of the pre-surgical visit is to check your medical condition and to plan for anesthesia. This program discusses what happens during the pre-surgical examination and the medical questions you may be asked. On the day of surgery, you will check in before going to the operating room. After the operation, you will be monitored in the post-anesthesia care unit. This program describes the surgical process and prepares you for the experience. After having surgery, you will either stay at the hospital or go home. If you go home, you will be given directions to follow, called discharge instructions. This program reviews some of the information that will be discussed in your discharge instructions. Waiting for surgery. After you have made the decision to have surgery, there may be a waiting period of as little as 1 day or as long as several weeks. This section covers some preparation tips you might use to prepare for surgery while you are waiting. Find out from your healthcare provider whether you are going to be an outpatient or an inpatient. Outpatient means that you go home the same day that the surgery is performed. Inpatient means that you stay in the hospital after the surgery for 1 or more days. Your surgeon will tell you the dates of your admission and surgery. If you have family members to take care of, make plans for someone else to care for them while you are in the hospital. Sometimes it is not possible to know the exact time of the surgery until the business day before the actual date. If this is the case, you will need to find out when you will be notified of the time of surgery. Ask your healthcare provider if you should change the schedule and dosage of any medications you may be taking. If you smoke, it is best to stop smoking before surgery. This helps ensure a faster recovery. You should stop smoking 2 weeks before the date of the surgery. Your healthcare provider will tell you if you are at risk for too much blood loss during surgery. Sometimes this can require a blood transfusion. If you are healthy and your operation is more than 4 weeks away, you might have an opportunity to store some of your own blood in case a blood transfusion is needed. When a person is given a transfusion of their own blood, it is known as an autologous blood transfusion. Pre-surgical visit. The pre-surgical visit is usually the day before surgery. During the pre-surgical visit, an anesthesia specialist examines you and reviews your medical history to determine what type of anesthesia is safe for you. He or she will do a physical exam and ask you questions regarding your health. Blood and urine tests, as well as heart tracings called EKGs, may be needed. Let your healthcare providers know if you have had blood tests, urine tests, or EKGs in the last 30 days. If so, you should either send the results to your healthcare provider ahead of time or take them with you to the pre-surgical visit. If you do not have the test results, you may be able to ask the healthcare provider that has them to forward them to your current healthcare provider before your pre-surgical visit. Be prepared to answer a lot of questions. Examples of questions you may be asked include, what prescription medications are you taking? Are you taking any non-prescription medications? Do you have any allergies to drugs or foods? If yes, what are you allergic to? Other questions you may be asked include, are you allergic to latex? Have you had anesthesia before? If so, were you allergic to any anesthetic drug? Do you know if any blood relative of yours has had problems with anesthesia? You should tell your anesthesiologist about any medical problems that you may have, such as heart, lung, or kidney problems, strokes, liver damage, previous blood transfusions, diabetes, high blood pressure, jaundice, depression, and psychiatric disorders should also be reported to your anesthesiologist. It is also important to tell your healthcare provider whether you have snoring problems and whether you have any loose teeth or dental work, such as bridges or crowns. Medications you may be taking could interact with the anesthesia used or could cause too much bleeding during surgery. Tell your anesthesiologist and surgeon about any medications you may be taking, even over-the-counter medications such as aspirin, Advil, or herbal supplements. Your healthcare provider may ask you to change the schedule and dosage of your medications before the surgery. You should also inform your healthcare provider if you drink alcohol on a daily basis. Some precautions may need to be taken to prevent you from suffering from alcohol withdrawal after the surgery. Based on your answers, your anesthesiologist and surgeon will determine the best anesthetic for you. There are 3 general types of anesthesia. 1. General anesthesia. 2. Regional anesthesia. 3. Local anesthesia. General anesthesia causes you to go to sleep and not feel pain. General anesthesia is either given through a mask or an injection. Regional anesthesia is used when a whole region of your body, such as an arm or leg, needs to be numbed or anesthetized. Examples of regional anesthesia include spinal anesthesia, epidural anesthesia, and nerve blocks. Local anesthesia is used for numbing specific limited regions of your body, such as an area of skin. You may have already experienced a local anesthetic if your dentist has ever numbed the nerves of one or more of your teeth. Due to advances in technology and medication, anesthesia is safe, but there are some possible risks and complications. You can do a lot to prevent them by telling your healthcare provider about your allergies, medications, and diseases. The risks depend on the type of anesthesia you will have and on your current medical condition. Your healthcare provider will discuss these risks with you. You will probably be admitted to the hospital on the day of surgery, but in some cases you may need to be admitted the day before. The following sections discuss what you may need to do or not do at home before the operation. Your surgeon or anesthesiologist may give you more specific instructions.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
The night before surgery. To avoid complications during and after your surgery, you must limit what you eat and drink. This is done because during surgery it is possible for the food in the stomach to be vomited and inhaled into the lungs. Do not eat, drink, chew, or suck on any food after midnight before your surgery. This includes gum, mints, and candy. If you have diabetes, ask your healthcare provider when the last time you should eat is. The medications your anesthesiologist asks you to take should be swallowed with a few sips of water right when you wake up on the morning of surgery. If you smoke, it is best if you stop smoking before surgery. If you cannot stop smoking, you should at least cut down on how much you smoke and not smoke after midnight the night before surgery. You should not drink any alcoholic beverages within 24 hours of the surgery. Your healthcare provider may also ask you to shower and scrub the planned incision area with a special disinfecting soap the night before surgery. Day of surgery. On the day of surgery, you will be admitted to the surgical area and an identity bracelet will be placed around your wrist. It is best to wear simple and loose-fitting clothes that will easily fit over a bandage. It is also best to leave jewelry and other valuables at home. All facial makeup and nail polish must be removed. A healthcare provider will review your medical history and perform a brief physical exam. Be prepared to answer questions regarding any medications you are taking. Be sure to tell your healthcare providers about anything you ate or drank after the time you were told to stop eating or drinking. To have surgery, you need to sign a consent form. Signing the consent form indicates that you know what the surgery is for, understand what the benefits and risks are, and allow your healthcare provider and other hospital staff to proceed with the surgery. The consent form protects you by ensuring that no one can operate before you understand and consent to the procedure. Only in extreme cases, where a life-saving operation is needed, you are unresponsive and no family can be reached, will a surgeon decide to proceed with surgery without formal consent. During surgery, you will be given a gown to wear. You will then meet your anesthesiologist, who will recheck your medical history and test results. Your anesthesiologist will be in charge of your anesthesia care throughout the surgery. They may give you a sedative to help you relax before the surgery. Though you may still be able to walk, you might be taken to surgery in a wheelchair or on a bed, also called a gurney. This ensures safer transportation. You may be taken to a surgery waiting area called the holding area before going to the operating room. Depending on the hospital policy, one or two of your family members or friends may be allowed to come with you into the holding area. If the patient is a child, a parent may be allowed in the surgery holding area or the operating room if the anesthesiologist decides this is best for the child. In the surgery holding area, you may see other patients and a lot of activity. If your hair needs to be clipped, it may be clipped there. From the surgery holding area, you will then be moved to the operating room, also known as the OR. If anesthesia has not already been started in the holding area, it will be started in the operating room. If your hair needs to be clipped and this is not done in the holding area, it may be done in the operating room. In cases of general anesthesia, you will go to sleep and a tube may be placed in your throat to help you continue breathing. You will be given some medication through an IV to relax you and put you to sleep. You will be closely monitored in the operating room. Your anesthesiologist or nurse anesthetist will continually monitor the oxygen level in your blood, your pulse, your blood pressure, and your respiration rate. They will give you any medications, fluids, or blood that you need. Some of the equipment they may use to monitor your vital signs includes a blood pressure cuff to monitor your blood pressure, a finger clip or sticky pad to measure your blood oxygen level, EKG patches on your chest to monitor your heart. If general anesthesia is used, a tube will be placed in your mouth to give you extra oxygen. If local or regional anesthesia is used, an oxygen mask will be used to give you extra oxygen. An intravenous line or IV line is used to give you any medicine you need. Immediately after surgery. Right after your surgery, you will go to the recovery room, which is also called the Post-Anesthesia Care Unit, or PACU for short. This is where trained nurses will monitor you as the anesthesia wears off. While you are in the PACU, your surgeon will meet with your family and friends to inform them about your condition and to answer any questions they may have. The PACU nurse will administer medication to reduce any pain you may have as a result of the surgical procedure. Do not be afraid to ask for more pain medication. When the PACU nurse is satisfied that your condition is stable and your pain has been treated appropriately, you will be discharged from the PACU to go home if you are an outpatient. Otherwise, you will go to your hospital room if you are to remain in the hospital. Some hospitals have an outpatient recovery room where you may spend a few hours before going home if you are an outpatient. Most patients usually spend 1 to 2 hours in the PACU. Depending on the type of surgery and your medical condition, the amount of time you spend in the PACU could be longer. Patients going home after surgery should not drive, operate complex equipment, make important legal decisions, or drink alcohol for 24 hours. Discharge instructions. If you are an outpatient, you will be discharged to go home on the day of surgery. If you are an inpatient, you will be discharged to go home after recovering at least one night in the hospital. You can do a lot to help speed up your recovery. The following are some general suggestions. Your healthcare providers will give you more specific instructions. These are called discharge instructions. Walk as soon as you can after surgery. Walking circulates the blood in your system and reduces the formation of blood clots, which could be fatal. You will have help when you take your first walking steps after surgery. Follow your dietary instructions. You will be given instructions on what you can eat and how you can slowly progress from drinking liquid food to eating solid food. Follow these instructions until your digestive system fully recovers from the effects of the surgery and anesthesia. Manage your pain. In the hospital, ask your healthcare provider for pain medication if you feel pain. If you miss a pill, do not double the next dose. Do not increase the dosage of your medication without asking your healthcare provider first. Do not smoke. Smoking may increase your chance of developing pneumonia. Smoking also limits blood flow and can slow healing. Depending on the type of surgery and anesthesia you are given, your healthcare provider may give you additional instructions. Do not be afraid to ask any questions related to your health and recovery. Healthcare providers appreciate it when patients take an active role in their healthcare. Here are some questions you can ask your healthcare provider before you go home. 1. What medications should I take and when? 2. What are the signs of infections and other common complications? 3. What should I eat? 4. What will happen to my stitches and staples? 5. When will I see my healthcare provider again? Other questions to ask include 6. When can I drive my car? 7. When can I go back to work? 8. When and how can I shower? 9. How much weight can I lift? Can I bend? 10. When can I have sex again? Ask your surgeon to share the summary of your hospital stay with your family physician. Ask your surgeon for detailed information on which medications you should take when you go home, whether there has been any change made to your home medications, whether you are allowed to resume medications you stopped taking before the operation, including blood thinners.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Find out from your healthcare provider whether you are going to be an outpatient or an inpatient. Outpatient means that you go home the same day that the surgery is performed. Inpatient means that you stay in the hospital after the surgery for 1 or more days. Your surgeon will tell you the dates of your admission and surgery. If you have family members to take care of, make plans for someone else to care for them while you are in the hospital. Your healthcare provider may ask you to change the schedule and dosage of your medications before the surgery. Planned surgery involves 4 basic steps: surgical consultation, pre-surgical visit, day of surgery, patient discharge. During the surgical consultation, you will meet with your surgeon to discuss the surgical treatment options and the benefits and risks of surgery. The purpose of the pre-surgical visit is to check your medical condition and to plan for anesthesia. On the day of surgery, you will check in before going to the operating room. After the operation, you will be monitored in the post-anesthesia care unit. After having surgery, you will either stay at the hospital or go home. If you go home, you will be given directions to follow called discharge instructions. Thank you for using Explain.